Okay, it's saying busy, and I think it's going.
Okay, hi, I'm Dr. Ackerman, and today I want to give you a short video on how to fix your shoulder pain. The reason I want to do this is years ago I had so much shoulder pain that I had multiple injections in my shoulders. I had a neurosurgeon friend of mine tell me that I needed surgery, and deep down in my heart I knew that I didn't need surgery. I knew something mechanically was not right with my shoulder. I just hadn't figured out what to do. So, long story short, I fixed my shoulder pain. I haven't had shoulder pain in years, and I primarily did it with this one move that I'm going to show you today. I've had so many patients in the past 6 months come in with shoulder pain that I've shown them this particular move. It's helped them, it's avoided injections, surgeries, saved them tons of money. I wanted to show you this. So, the problem with the shoulder is that it starts to get pinched when you move it because the shoulder isn't moving properly. For example, the shoulder is a ball and socket joint. It's supposed to move in all sorts of directions. Well, when your shoulders are rotated forward, kind of like this, which is what most people do, when you go to raise your arm, it hits right there. It won't go any further. But if your shoulders are more back like this, a better posture, your arm goes right up and it doesn't hit. So what's happening is most people's shoulders, they come up and they hit, and they hit, and they hit, and they hit. Well, there's a tendon that runs in that space. And when you hit that tendon long enough, it starts to fray and tear that tendon, and that's how people end up with a torn rotator cuff without having any specific injury. So the fix is to make this stop happening so that when you raise your arm, your shoulder rotates and it never pinches. And you can do that real simply. What you've got to do is you've got to stretch your chest muscle, the big pec muscle here, that gets real strong, and that's what pulls people forward, okay? Because we do everything in front of us. We work on computers. If you're a mechanic, you're working here. We eat here, we sleep here. We do everything right in front of us. Our pec muscle gets tight, and the little muscles between your shoulder blades aren't strong enough to pull your shoulders back. So we got to do two things. We got to stretch the muscles in your chest, and you've got to strengthen these little muscles in between the shoulder blades. The good thing is we can do that with one move. We can strengthen the muscles and stretch the front all at the same time. The way we do that is put your hands behind your back, interlace your fingers, and lower your hands down, pull your shoulder blades together, and so you look like this from the front. It was kind of weird. This is what it looks like from the side, and then from the back. So you want to be sure to squeeze those shoulder blades together and then relax. If you'll practice that move, do it for 5 seconds. Do it 5, 6, 7 times a day. Over the next couple of weeks or a month, your posture will improve. Your shoulder will stop slamming up against itself and pinching that tendon. The inflammation will go away, the pain will go away, and the range of motion will come back. So if you're having shoulder pain, give this a try. If it persists, go see your doctor, go see your orthopedist, your family doctor, chiropractor, and hopefully this will help you. Leave some comments if you like this and if it's helped you. Appreciate it. Have a good day.